General safety. Ask your supervisor if you have any questions after this presentation. Safety is everybody's business. There's a spill here and she doesn't wipe it up. She leaves the knife sharpened in the walkway. She leaves the pot handle in the walkway. Now this poor unsuspecting person slips, gets the knife in them and the pot handle, and the pot falls on it. This cord sprayed. This person is putting a cord across a walkway. And of course they trip. This person is leaving a chemical out on the counter. And of course one of our residents comes in and gets the chemical and uses it as hairspray. This employee leaves the file drawer open and later comes back and trips over it. So you don't want to do that. Safety is staying free from injury or illness. The federal agency that surveys workplaces to see if they are safe is called OSHA, the Occupational Safety and Health Administration. Why worry about safety? Well, common reasons. You want to keep your residents free from injury, and you don't want to get hurt. It is not fun being hurt. So why worry about safety? Healthy employees are more productive employees. Types of injuries in nursing home. Most of them are bodily reaction exertion injuries. Some are falls, and others are contact with equipment and other assorted injuries. Mostly nurse aides account for most of the injuries, then other nurses, and then maids, janitors, laundry workers. Again, patient or resident accidents are most common. Otherwise, it would be walkways and slips, which I illustrated earlier, then furniture and others. Causes of accidents that can cause injury, illness, pain, or even death. Complacency. You do a job so frequently you're not paying attention to what you're doing. You're talking with your coworker. Other causes could be you're so emotionally distracted and upset you're not paying attention to what you're doing. I would suggest that if something horrible happened, like you broke up with a boyfriend, I would call in because you may be so distracted you won't be able to do your job properly and you could be injured. Obviously, I expect that that's not going to happen often. If you're so tired and worn out, you could cause an accident. Again, you may want to call in if you don't function well when you're tired, but again, don't do that very often. And you don't want to be reckless, thinking safety rules don't apply to you. You need not be selfish and thinking no one else is affected by your actions. Fooling around is for fools. Don't rush. Slow down. Be attentive during safety talks. Be eager to understand our workplace procedures here at Divine. Be alert for anything that doesn't feel right. Have that sixth sense. I remember it was 6 a.m. in the morning at St. Mary's and we were getting people ready for surgery and we were doing rounds, and I felt this need to wake somebody up at 6 a.m. in the morning when we're very busy who didn't need to get woken up. So I went in and tried to wake him up and he wouldn't wake up, and then I took his blood pressure. He didn't have much of a blood pressure. So we called the code, and the code team got down there and they were able to get his blood pressure and heart going better. And later we found out that was Sister Mary Bry's brother, and Sister Mary Bry was the head nun of St. Mary's Hospital at the time. So, I wonder what was going on with that. Stay focused on your job. We want you to wear non-skid shoes. Clean up spills immediately. We had a housekeeper and the floor was wet and she walked on it and she slipped and she broke her wrist. And she broke her wrist so bad it had to have surgery and she couldn't work for 3 months. So please post those spill cleanup in progress signs. Place electrical cords so they are not a tripping hazard. Always walk, don't run. Keep equipment out of halls. Who is responsible for cleaning up spills? you. Report any frayed cords. Match plug with outlet. So a 3-prong goes with a 3-prong. No adapters. Don't touch anything electrical with wet hands. Don't overload our circuits. Report any equipment that smokes and immediately take it out of service. Don't use extension cords without approval. The lockout tagout law covers servicing machines safely. Make sure equipment doesn't turn on or have some sort of power left in it. Broken machinery should be tagged and or unlocked. Or locked, pardon me. Power can be electrical, mechanical, hydraulic, pneumatic, chemical, or thermal. We lock up chemicals and meds, oxygen. Hearing damage can occur from very, very loud noises. So some machines like the lawnmower, we may wear ear covering. Heat stress or burns can occur from high temperature like the dryer, a hot water heater, furnace, stove, or oven, and especially that steamer. And then on hot days, check your residents to make sure they drink lots of fluids. Injury can occur from anything with moving parts. What machines here have moving parts? Our tubs, our wheelchairs, our lifts, oven, carts. You think about that in your department. Throw rugs are not allowed anywhere in the facility. They are a tripping hazard. We have to keep rooms free from clutter. It's especially hard on the night shift because there's not as much light and they may run into something. Keep residents' equipment within reach so they don't fall getting up to get something. And doing resident rounds helps that. You look into their room and check that they have everything they need. Incident reports need to be filed within 24 hours. The supervisor fills it out before the end of the shift. Do something about something unsafe. Report any hazardous concerns to your supervisor. What can you do to work more safely? Think about that every day. Here in Rose Hall, they did not look up at the mirror, and we usually walk on the right side of the hall. Sometimes there's people with a wheelchair here and you can get hit. This time they looked in the mirror and they're walking on the right side of the hallway. Think about what you're doing. Obviously, these people are not thinking about what they're doing. That does not look safe. She's wiping up the spill and marking it as wet. Putting the knife on the counter without it pointing out. The pot handle is not out in the walkway. Evaluating what he should do with that fan. And he's not putting it across the hall, so it would be a tripping hazard. Decided to put the chemical away and lock that cupboard. And the file drawer is out. He's actually in the administrator's office. He's my son and he's a bed maker. It doesn't look good, but shh. This video was like 8 years ago. And he's happy. Okay, well, you get the idea. Thank you.